There is a particular kind of humiliation that only happens in waiting rooms, not the kind that comes from someone raising their voice, or pointing a finger, or making a scene that other people turn to watch. The quiet kind. The kind delivered in a tone just low enough that the person receiving it understands they are not worth the energy of full volume. The kind where the person doing it keeps their eyes on their paperwork the whole time, because the person sitting across from them does not warrant eye contact. That is the kind Marcus Hale received on a Tuesday afternoon in the third week of October, when he carried his 7-year-old daughter through the automatic doors of Linden Regional Medical Center and walked to the front desk of the pediatric emergency wing with Sophie's head against his shoulder and her breathing shallow in the way that had been getting worse for 4 hours. He had noticed the breathing at pickup. Sophie attended second grade at Linden Elementary, 3 blocks from the apartment they had shared since her mother left when Sophie was 2. Marcus had been raising her alone since then, not tragically, not heroically, just steadily, the way you raise a child when there is no other option, and the child is worth every hour of it. He worked, he cooked, he learned which cartoons she liked and which ones gave her nightmares. He learned that she would eat broccoli only if it was cut very small and mixed into something else, and that she needed the lamp in the hallway left on, and that when she was sick she wanted to be held and not talked to, just held. She had been coughing for 2 days. He had given her the children's medication, kept her home from school Monday, watched her carefully, the way parents who do not panic still watch carefully. By Tuesday afternoon, the cough had changed. It was lower, different in the chest, and her breathing between coughs had taken on a quality he could not name but could feel. Something slightly wrong in the rhythm of it. He did not overthink it. He signed her out of school at noon, drove directly to Linden Regional, and carried her in because she said her legs were tired. The woman at the front desk of the pediatric emergency wing had a lanyard that read Patient Services and a name badge that said Carol. She was perhaps 50, with reading glasses on a beaded chain around her neck and the practiced expression of someone who has developed very efficient methods for categorizing the people who arrive at her desk. Marcus stepped up to the desk. Sophie's weight shifted against him. He had his insurance card already out, because he had learned a long time ago that this was the thing they asked for first, and having it ready saved time. "Hi," he said. "My daughter is having trouble breathing. She's had a cough for 2 days, and it changed this afternoon. Her name is Sophie Hale. She's 7. Carol looked at the insurance card he placed on the desk. She picked it up. She looked at it the way people look at things they have already decided about. Then she set it down and turned to her computer. "Primary insurance," she said. "That's it. Right there. The card. I see the card." She typed. "This is through." She paused, and there was something in the pause. "Linden County Community Health Plan." "Yes." Another pause. She typed something, stopped, typed again. "This plan has a high deductible." "I know what my plan has," Marcus said. His voice was even. He had practice keeping it even. "For emergency visits, the deductible applies before coverage begins." She still had not looked at him. "The out-of-pocket for an ER visit under this plan can be significant." "I understand. And my daughter needs to be seen. We do have a financial assistance application, if you'd like to." "She's having trouble breathing," Marcus said. He said it calmly, but he said it clearly. "I would like her to be seen by someone who can assess her breathing." Carol looked at him then. Just briefly, the look of someone recalibrating, but not by much. "I'll need to make a copy of this." She took the insurance card and a photo ID. He provided his driver's license. She made copies with the deliberateness of someone who has decided that deliberateness is a form of authority. Then she slid a clipboard across the desk with a stack of intake forms. "Fill these out completely and bring them back. Someone will call her name when a room is available." "How long?" She glanced at the waiting area, which had perhaps 12 people in it. "We'll call her name when a room is available." Marcus took the clipboard. He carried Sophie to a chair in the corner, settled her in his lap, and filled out the forms with one hand while she leaned against his chest. Her breathing was still wrong, not alarming wrong, not the kind of wrong that required him to stand up and demand something immediately, but wrong enough, wrong in the way that sits in a parent's chest like a stone. He returned the forms. Carol took them without looking up. He went back to the chair. He waited. 40 minutes later, a nurse came to the waiting room door and called Sophie's name. Her name was Teresa, and she was brisk and thorough and very good at her job. She assessed Sophie's breathing within 90 seconds of meeting her, listened to her chest, checked her oxygen saturation, and had her in a room with a breathing treatment started within 4 minutes of that. Marcus sat in the chair beside Sophie's bed and held her hand while the medication began to work, and he felt the particular relief that moves through a parent's body when the crisis is resolving. Not celebration, not triumph, just the slow unwinding of everything that had been coiled tight for the last several hours. The attending pediatrician came within 20 minutes. Her name was Dr. Reyes, and she was warm and direct, and explained that Sophie had bronchial inflammation consistent with the early stages of reactive airway disease. The kind of thing that, caught early and treated properly, was entirely manageable. She wrote a prescription, explained the follow-up protocol, answered every question Marcus asked, and shook Sophie's hand before she left. Sophie's color had come back. She ate half a cup of crackers from the tray the nurse brought. She fell asleep around 4 in the afternoon with Marcus's jacket folded over her like a blanket. Marcus sat in the chair beside her bed and did something he had not had time to do since Sophie's breathing had gone wrong that morning. He thought about Carol, not with anger, exactly. Anger was a thing he had learned to be very careful with, because anger, for a man who looked like Marcus, in rooms like this one, cost more than it was usually worth. But something else, something quieter and more durable. He thought about the pause before Linden County Community Health Plan. The way the card had been placed back on the desk. The suggestion of the financial assistance application, before anyone had assessed whether Sophie needed medical attention. The 14 minutes between when he first presented at the desk and when the forms had been copied and processed, during which Sophie sat against him and breathed wrong. He thought about how many other people had sat in that chair. How many other parents had carried sick children through those automatic doors and received that pause, that calculation, that clipboard as a first response to a child who needed to be seen. Marcus Hale had been doing a specific kind of work for the past 3 years. It was not work that showed up anywhere on his face, or in his apartment, or in the way he signed Sophie out of school, or drove her to the pediatric emergency wing in a car that was 5 years old. He drove a 5-year-old car because he had learned early that how a thing appeared was separate from what it was, and he had found the separation useful. 3 years ago, he had begun the work of acquiring Linden Regional Medical Center. It had started, the way most things of consequence start, not with ambition, but with necessity. Marcus had grown up in Linden. He had grown up on the east side of Linden, which was the side that did not appear in the Chamber of Commerce materials, the side where the grocery store had closed in 2009 and not been replaced, where the nearest emergency room had been Linden Regional, until Linden Regional had closed its east side urgent care satellite in 2017, citing operating costs, where the families who needed medical care the most had the most distance to travel to reach it. His mother had needed medical care. She had needed it specifically in the fall of 2018, when the chest pain she had been describing as heartburn for 6 weeks turned out to be something considerably more serious. She had described it as heartburn because she had learned, over a lifetime of presenting at medical facilities with inadequate insurance, and the particular expression that people develop when they have been told to wait a few more times than is reasonable, that downplaying was more efficient than accuracy. She had survived. She was living now in a house Marcus had purchased for her in a quiet part of town, and she was healthy, and she had opinions about Sophie's diet that she shared freely and that Marcus accepted with affection. But in the fall of 2018, sitting in a different waiting room of this same hospital, Marcus had looked at his mother's face and then at the insurance card in his hand, and then at the person behind the desk and thought, with the clarity that sometimes arrives in the middle of crisis, I am going to fix this. He was 31 years old at the time. He had been working in healthcare investment for 6 years, after a degree in economics and 2 years doing analytics for a regional insurance company, where he had learned more about how money moved through the medical system than most people learn in a lifetime. He understood, with the precision of someone whose job required precision, exactly how the financial architecture of a hospital worked, what made one solvent and another not, where the leverage points were, how much you needed, and in what order, and from whom. He had not told anyone what he was doing. Not his colleagues at the investment firm where he worked, not his mother, not the small number of people he trusted enough to call friends. He had worked and saved and built relationships in the healthcare investment space with the patience of a man who understood that patience was the only strategy that actually worked. He had also, 3 years ago, acquired a 7% stake in Linden Regional's parent company through a private equity vehicle that was not, on its surface, connected to his name. In the 2 years since, through a series of transactions that his colleagues in the industry would have found impressive if they had been watching, the stake had grown. The stake had grown because Linden Regional's parent company, Meridian Health Partners, was not well run. It was not poorly run in the way that attracted attention. It was poorly run in the quiet, structural way that erodes an institution over time. Unnecessary administrative layers. Contracts with vendors that had not been renegotiated in a decade. A capital allocation strategy that prioritized the facilities in the company's highest income markets and systematically underinvested in the ones that served populations like the east side of Linden. Marcus had identified every one of these problems with the specificity of someone who had been looking for them. He had brought in 2 additional investors, people he trusted, people whose money was patient, and whose motivations he understood. And together, they had acquired enough of Meridian Health Partners, quietly and over time, that by the Tuesday afternoon, when Marcus carried Sophie through the automatic doors of the pediatric emergency wing, he owned, through his investment vehicle, a controlling interest in the company that owned Linden Regional Medical Center. He had not announced this. There was a process for these things, and the process was not finished, and Marcus was not a man who made announcements before processes were finished. But the process was very nearly finished. The remaining formalities, the regulatory filings, the board notifications, the transition documentation, were scheduled for completion within the next 4 weeks. He knew this because he had been working toward it for 3 years, and because he was, by this point, the kind of person who knew exactly when things were going to be completed. Carol did not know any of this. Carol knew that a man with a community health plan high-deductible insurance card had arrived at her desk with a sick child on a Tuesday afternoon, and that she had processed his paperwork and directed him to the waiting area, and that the child had been seen and treated and was apparently doing fine, and that this was essentially how emergency intake worked. She would not have described what she had done as anything other than her job. She had not been rude to him, exactly. She had not raised her voice or said anything that could be quoted and found objectionable. She had asked standard questions about insurance coverage. She had mentioned the financial assistance application, as she had been trained to do when she identified plans that fell within certain parameters. She had processed the forms. She had also, in the 40 minutes between when Marcus presented at her desk and when Teresa came to the waiting room door, called the name of 2 other patients whose plans fell outside those parameters, a word she did not use but a category she absolutely operated from, before she called Sophie's name. She had not noted this in any documentation because it was not a thing that got noted. Marcus had noticed. He had been sitting in the corner chair with Sophie against his chest and 40 minutes to notice things. He noticed many things that afternoon, in the 4 hours between Sophie's admission and the moment the pediatrician discharged her with a prescription and a follow-up appointment card. He noticed how the intake process differed depending on what a patient's paperwork revealed. He noticed which staff members introduced themselves and which ones did not. He noticed the condition of the pediatric waiting area, the chairs that needed reupholstering, the information boards with materials that were 18 months outdated, the single water fountain that was labeled out of order with a handwritten sign that had clearly been there long enough to yellow at the edges. He was not conducting an inspection. He was just noticing. He noticed things the way people notice things when they have spent 3 years learning exactly what they are looking for. On the way out, carrying Sophie, who was substantially better and had eaten another half cup of crackers and shown him something on his phone about a cartoon dog she liked, he passed the front desk. Carol was still there. She was typing, not looking up. He stopped. "Excuse me," he said. She looked up. The same expression, the categorizing one. "My daughter was discharged. Thank you for processing us." Carol blinked. "Of course. I have one question." His voice was the same as it always was. Level. Unhurried. She waited. When she was admitted, it was 40 minutes between when I presented her at the desk and when a nurse came to the waiting room. 2 other patients were called before her. Do you know if the triage protocol accounts for age and presenting symptoms in determining priority order? Carol looked at him for a moment. Triage is determined by clinical staff. The nurse, not front desk. That's correct. So the order in which names are called from the waiting room, the 40 minutes, that's a front desk function. A very brief pause. We process in order of intake completion. I see. Marcus shifted Sophie's weight on his shoulder. She was half asleep. Completion meaning when the forms come back, and when insurance verification is complete, and verification takes different amounts of time depending on the plan. Carol said nothing. Thank you, Marcus said. I hope you have a good evening. He carried Sophie through the automatic doors. The October air was cold and smelled like rain. In the car, with Sophie buckled in the back seat and already fully asleep against her booster pillow, Marcus sat for a moment before starting the engine. He was not angry. He had processed the anger somewhere between the second name being called from the waiting room and the moment Sophie's color started coming back under the breathing treatment. What he was, sitting in the parking lot of Linden Regional Medical Center at 5:30 in the evening on a Tuesday in October, was decided. He had been decided before, but in a general way, the way you are decided about a thing you are working toward over years, when the work is distant enough that it can still be abstract. He was decided now in a specific way. The way you are decided when the thing is no longer abstract, because it is your daughter sitting in a chair breathing wrong, and the first 4 minutes of the response to that are a conversation about deductibles. He called his attorney from the parking lot. "Where are we?" he said. Marcus, his attorney, whose name was Diane and who had been working with him on this for 2 years, paused briefly. "We're 4 weeks out from the full transition. Like we discussed, the regulatory filings are. Can we compress that?" Another pause. Longer. How much? Significantly. Define significantly. 10 days. He could hear Diane thinking. That would require accelerating the board notification process and front-loading several of the filing sequences that we spread out specifically to avoid. I know what we spread out and why. Can it be done? It can be done, Diane said slowly. It will be more expensive, and it will require you to be more visible in the process than we planned. I'm aware, Marcus. Her tone had shifted slightly. Something had happened, she understood, that had changed his timeline. She was professional enough not to ask what. I'll start making calls tonight. Thank you. He started the car. Sophie made a small sound in the back seat. Not distress, just the sound children make when they are settling into deep sleep. He adjusted the rearview mirror so he could see her face. She was breathing evenly, perfectly, the way she should have been breathing all afternoon. He drove home. The next 10 days were the kind of days that do not look dramatic from the outside. Marcus went to work. He dropped Sophie at school, where she had been cleared to return after 48 hours, with her new inhaler in her backpack and a note for the school nurse, and the certainty that he had done everything right, and the slightly different certainty that everything around them was not always designed to do the same. He answered emails. He attended meetings. He had the calls with Diane and the 2 investors, and the regulatory consultants that were necessary to compress a 4-week timeline into 10 days, without creating errors that would require correction later. He was precise, because he was always precise, and because precision was the only thing that protected the work from being undone by carelessness. He picked Sophie up at 3 o'clock every day. He cooked dinner. He read to her at bedtime. They were in the middle of a book about a girl who trained horses, which Sophie had opinions about that she shared at length. He administered the inhaler on the prescribed schedule and watched her breathing the way parents who have recently experienced a breathing scare watch breathing, which is to say with the background attention that never quite turns off. On the 9th day, Diane called. "We're ready," she said. The board of Meridian Health Partners was notified of the completed acquisition on a Thursday morning. The regulatory filings were confirmed. The documentation was signed and filed and timestamped. Marcus Hale now controlled Linden Regional Medical Center and the 4 other facilities under the Meridian Health Partners umbrella, through a structure that was unambiguous and legal, and the result of 3 years of very deliberate work. He did not issue a press release. He did not post anything. He called his mother, who said, "I always knew," which was not true, but was the kind of thing mothers are entitled to say. He picked up Sophie at 3 o'clock. He went to work on Friday. The meeting was scheduled for the following Monday, not announced broadly. An executive transition meeting, as these things are called. The incoming ownership's representatives meeting with the current administrative leadership of Linden Regional Medical Center. Standard for a transition of this kind. Marcus arrived 12 minutes early, which was his habit. He was wearing a dark suit, which he did not often wear, and carrying a briefcase, which he used only when the occasion called for a briefcase, and which this occasion did. The conference room was on the 4th floor, the administrative floor, a level that the people who worked in pediatric emergency intake did not have frequent occasion to visit. The Meridian Health Partners interim CEO, a man named Gerald who had held the position for 14 months and was not certain how the next hour was going to go, was already seated. Several of the department heads were present. The CFO, the Chief Medical Officer, the Director of Patient Services. The Director of Patient Services had brought her direct reports. The Director of Patient Services was not Carol, but Carol was one of her direct reports. And Carol was one of the 3 people the director had brought to represent the patient-facing intake and administrative functions. Carol was seated 3 chairs down from the end of the table. She was wearing her lanyard. She had a notepad in front of her and a pen she was not using. She had been told this was a transition meeting with the new ownership group. She had not been given more information than that. She looked at Marcus Hale when he entered the room. She did not place him immediately. He looked familiar. She had the sensation of someone whose memory is pulling at something without yet delivering it. Marcus sat at the head of the table. He set his briefcase down. He looked at the room the way he looked at most rooms, with the particular quality of attention that reads as calm but is actually comprehensive. Gerald welcomed him, with the professional courtesy of a man who is in the process of understanding that he is no longer the most important person in the room he has been running for 14 months. Marcus thanked him. He introduced Diane, who was seated beside him. He made brief, accurate remarks about the acquisition, what it represented, what the objectives were, what the transition timeline looked like. He spoke without notes, because he did not need notes. And he spoke with the directness of someone who has been working toward a thing long enough that the words for it come easily. Then he said, "I'd like to spend some time on patient services, specifically intake processes in the emergency wing." The Director of Patient Services sat up slightly. "I had occasion to visit the pediatric emergency wing recently," Marcus said. "I found the clinical staff excellent. I want to be specific about that. Teresa, the intake nurse, was thorough and skilled, and made an immediate assessment that was exactly right. Dr. Reyes was outstanding." He paused. "I had some observations about the administrative side of the intake process." He described, without drama and without imprecision, what he had observed. The insurance verification process and how it affected the sequencing of patient calls from the waiting room. The time gap between presentation and clinical contact. The mention of financial assistance applications as part of the initial response to a patient presenting with a child in respiratory distress. The room was quiet. "My daughter," he said, "is 7 years old. She was having difficulty breathing." The first response to that difficulty was a 14-minute insurance verification process and a mention of financial assistance applications. He let that sit for a moment. "I want to understand how this became the protocol." The Director of Patient Services began to speak. Marcus listened to her completely. She explained the system, the intake protocol, the insurance verification requirements, the financial assistance notification policy that had been implemented in 2021 as a compliance measure related to federal guidelines around financial transparency in medical billing. She explained it accurately and professionally, and without, Marcus noted, any attempt to minimize what had happened. He asked questions. Good ones. The kind that showed he had already done significant reading on hospital intake protocol and federal compliance requirements, and that he understood the difference between a policy that was designed to be compliant and a policy that had been implemented in a way that created a different outcome than the one intended. Gerald, who had been watching this exchange with the expression of a man calculating, said nothing. Carol had placed him. She had placed him precisely 2 minutes into Marcus's description of his visit to the pediatric emergency wing. She had placed him when he said 14 minutes, and financial assistance application, and Sophie. She remembered Sophie. She remembered the community health plan card. She remembered the copy she had made and the clipboard she had slid across the desk. She did not look at her notepad. She looked at the table in front of her and felt, in a way she would later spend considerable time thinking about, the precise reversal of the dynamic she had operated from at her desk on a Tuesday afternoon in October. The specific experience of understanding that you have categorized someone incorrectly, and that the cost of that miscategorization is being presented to you in a room you cannot leave. Marcus was not looking at her. He was looking at the director of patient services, and then at Gerald, and then at the chief medical officer, discussing with specificity and without cruelty the structural changes he intended to implement in the intake process. The changes were, Diane would later tell him, comprehensive and operationally sound in a way that reflected a deep familiarity with how hospitals actually worked. Triage sequencing that prioritized presenting symptoms regardless of insurance verification status. A restructuring of the financial counseling protocol that moved it entirely out of the initial intake interaction and into a separate process that occurred after clinical assessment. New training requirements for all patient-facing administrative staff. Updated staffing levels in the pediatric waiting area. A deferred billing option for patients with high-deductible plans that did not require a separate application and approval process to access. And, he said toward the end of the meeting, a commitment to reopen the East Side Urgent Care satellite that had been closed in 2017 citing operating costs. That one landed differently in the room. Gerald's expression shifted in a way that indicated he had not anticipated that particular item on the agenda. The East Side closure was a cost decision, Gerald said, carefully. I understand that, Marcus said. The operating cost of a satellite urgent care facility in a low-income area is real. The cost of what happens to the people in that area when they can't access timely care is also real. He paused. I grew up on the East Side. My mother lives there. I have some familiarity with the second kind of cost. Gerald said nothing. The satellite reopens in the spring, Marcus said. We'll need to begin the staffing and regulatory process within the next 30 days to make that timeline work. He moved on to the next item. The meeting lasted 2 hours and 40 minutes. At the end of it, Marcus stood, shook hands with the people who offered theirs, and said that his team would be in touch with specific implementation documents for each of the areas discussed. People began gathering their things. Carol was moving toward the door when Marcus said, still without looking directly at her, to the room in general, I want to be clear that the changes I've described are structural. They're about the systems we've built and what we've allowed those systems to become. Individual accountability is a separate conversation and one I take seriously, but the first priority is fixing the thing that produces bad outcomes. He paused. The second priority is making sure we have people in every patient-facing role who understand what the job actually is. He said it to the room. Carol understood that at least part of it was meant for her. Not cruelly, not as punishment. The way you say a true thing that is also, for one person in the room, specifically pointed. She thought, walking to the elevator, about a man she had not looked at directly, carrying a child against his shoulder, and a card she had placed back on the desk, and a question she had answered in a way that was technically accurate and also entirely beside the point. She thought about the 14 minutes. She pressed the elevator button. She rode down to the second floor. She went back to her desk. She sat there for a few minutes. Then she picked up her phone and called the manager of the patient services training program and asked about the next available opening for the de-escalation and implicit bias training that she had twice been offered and twice not taken the time to complete. The opening was the following week. She signed up for it. Marcus picked Sophie up at 3 o'clock. She had, by her account, a good day. She had learned about the water cycle, which she found genuinely interesting, and wanted to explain to him in the car. She had eaten all of her lunch except the apple slices, which she would have eaten if they had been with peanut butter, a note he made for tomorrow. She had used her inhaler once, mid-morning, following the protocol perfectly. He listened to her explain the water cycle for 12 minutes without interruption. It was a good explanation. She had some of the vocabulary slightly wrong in ways that were charming and also, he thought, worth gently correcting later when she wasn't still mid-sentence. Did you know, she said, that the same water we drink now is the same water that was there in dinosaur times? I did know that, he said. That's weird, she said, but also kind of cool. Both things at once, he agreed. He made pasta for dinner. She helped stir. She set the table with the arrangement she preferred, which involved the forks being on the right side instead of the left, a preference she had maintained since she was 5, and which Marcus had long since accepted as simply the way their table was set. After dinner, after the dishes, after the bath and the inhaler and the first chapter of the horse book, the girl had found an injured stallion in a field, which Sophie found extremely significant and wanted to discuss at length, He sat in the chair beside Sophie's bed until she fell asleep, which took 11 minutes. And then he went to the kitchen and made tea and sat at the table in the quiet of the apartment. His phone had 47 notifications. He looked at none of them. He looked at the table. The forks were still on the wrong side, the way Sophie liked them, the way their table was always set. He thought about his mother, in 2018, describing chest pain as heartburn because she had learned that downplaying was more efficient than accuracy. He thought about the East Side urgent care satellite that had closed in 2017 and the distance between the East Side and Linden Regional, and what that distance meant at 3 in the morning when someone you loved was having chest pain that was not heartburn. He thought about the water cycle and how the same water moves through everything, in and out and back again, and how the 7-year-old asleep in the next room had found that strange and also kind of cool. He drank his tea. He thought, the work is not finished. It is never quite finished, but it moves forward. He washed his cup. He turned off the kitchen light. He checked Sophie's breathing one more time. Perfectly even, perfectly steady, and then he went to bed. Outside, Linden was quiet. The East Side and the West Side and the hospital on the hill with its automatic doors and its 4th-floor conference room, where, in the morning, people would begin the work of implementing things that should have been true all along. The same city it had always been. Beginning again, to become something better. The East Side Urgent Care Satellite opened the following April. It opened on a Thursday, which was not a special day, which was the point. Not a ribbon cutting, not a press event with speeches and photographers. Just a Thursday when the doors opened at 7 in the morning, and the first patient, a woman in her 60s with a persistent ear infection who lived 4 blocks away and had been putting off addressing it for 3 weeks because the distance to Linden Regional had seemed like too much, came in and was seen within 20 minutes and left with a prescription and the specific relief of a person who has been heard by someone in a medical setting without having to first establish that she deserved to be. Marcus was not there. He was at Sophie's school at 7 in the morning because there was a 2nd-grade science fair, and Sophie had built a model of the water cycle that was genuinely impressive, involving a heat lamp and a glass dish and a piece of plastic wrap that produced real condensation, and she had wanted to set it up before the other kids arrived because she had opinions about the presentation of it. He stood beside her and watched her explain it to her teacher, and then to 2 of her friends, and then to a parent he didn't know who stopped to look, using the vocabulary mostly correctly and with the particular intensity of a 7-year-old who has found a thing genuinely interesting and wants you to find it interesting too. It's the same water, Sophie told the parent, that was there in dinosaur times. It just keeps moving. The parent smiled and agreed that this was remarkable. Sophie looked up at Marcus with the expression she had when she wanted him to confirm that she had explained something correctly. Exactly right, he said. She nodded, satisfied, and turned back to adjust the heat lamp. The same water. Moving through everything. In and out and back again. He watched her work. Outside, 4 blocks from a clinic that had not existed yesterday, a woman with a prescription in her pocket walked home in the April morning, and the distance was nothing, and everything continued forward.